Hi, everyone, and thank you for tuning into this webinar all about osteoarthritis, where I'm going to be covering myths and management about the condition. My name is Luke. I'm an osteopath, and I'll be your host for this evening. All right. Now, quickly, before we get on to the topics at hand, just a little bit about me. I'm an osteopath, and for those of you who don't know what an osteopath is, we are primary healthcare practitioners, which means you don't need a referral of any sort to come to see us. And we primarily treat musculoskeletal complaints, so strains, sprains, muscle injuries, pain in the back, pain in the neck, etc. With manual therapy, using our hands to treat primarily, massage, stretching, manipulation. But that's just not all we do. We incorporate a lot of exercise rehabilitation and a lot of education into our treatments, and that's something that I'm highly interested in. And to further that, I've done studies in strength and conditioning, so using exercises to help you recover and help you improve your physical functioning. I've got a large interest in running injuries, shoulder complaints, and chronic pain. And I am quite an active person, doing cycling, running, snowboarding, and because of all those, I love to sleep. So without further ado, let's get into the content of osteoarthritis, the myths and the management. It just so happens that October the 12th, today is World Arthritis Day. Just a happy coincidence that I planned for this webinar to be on today. I didn't know actually until today that this was happening. So it all fell together perfectly. Arthritis versus osteoarthritis. There is some confusion when people say, I have arthritis and then I have osteoarthritis. What's the difference? Essentially, arthritis is the umbrella term for over 100 different types of conditions that are all variations on arthritis. And osteoarthritis is one of those conditions. Think about it as there's car as a type of transport, and there are many different types of cars. Arthritis is a type of condition, and there are many different types of arthritis. Osteoarthritis is just one of those. Others can be rheumatoid arthritis, psoriatic arthritis. You can have gout. You can have arthritis from infections. You can have arthritis from autoimmune conditions. There are many different causes of arthritis, and we're just going to be covering the osteoarthritis today. So what is osteoarthritis? A quick dictionary definition, which I don't necessarily agree with all of it, and you'll see why in a moment. Degeneration of joint cartilage and the underlying bone, most common from the middle age onwards. It causes hip pain and stiffness, especially in the hip, knee, and thumb joints. So where it says it causes pain and stiffness, I'll put it may cause pain and stiffness, because it doesn't always cause pain and stiffness, and I'll explain that in a moment. Especially in the hip, knee, and thumb joints. They are the most common joints to have osteoarthritis, but it can happen anywhere in the body, in your wrist, in your elbows, in your shoulders, in your neck, in your back. Can occur anywhere. So I'll be breaking down some of this definition as we talk. If we break down the word osteoarthritis, it gives you a basic understanding of what is occurring. Osteo means bone. Arthur is joint, and itis is inflammation. So we have inflammation of around the bone and the joint, or around the bony joint. There's inflammation around the bony joint. And that's an oversimplification of what is happening in osteoarthritis, but it is one of the processes that is occurring. So if we have a look at these pictures here, I'm going to talk through the process of osteoarthritis. So let's just imagine this is a knee joint. You've got a bone coming down and a bone coming up. In the joint, normally you have space between the two bones so you can move. If they are stuck together, you can't move. And within that joint, you often have fluid, which is normal. It's lubricating. It helps things move easier. On top of this bony surface, this blue here is cartilage. Nice, healthy, normal cartilage. Around the joint, you have a capsule, which is imagine like a glad wrap ball to hold everything together. You've then got tendons of the muscles. You've got muscles themselves. You're going to have ligaments covering. So there's a lot of things going on around the joint. And the way joints stay healthy is through a process called remodeling. So the cartilage, we'll talk about the cartilage in particular here, is constantly undergoing remodeling, where old tissue that has passed its use by date is removed and new tissue, new healthy tissue is laid down. So there's a constant out with the old, in with the new to keep everything healthy. So that's happening in the cartilage, it's happening in the bone, it's happening in the muscle. It's how the body repairs itself. Out with the old, in with the new. When we have an osteoarthritic condition, however, we see here that this cartilage has been thinned, and you may have irritation of the bony surfaces because there's not as much shock absorption. The cartilage provides a bit of shock absorption and prevents the bone becoming irritated. The remodeling process, especially as we get older, slows down. So we have too much out of the old and not enough in with the new, which means that gradually the cartilage will become thinner, and therefore the bone may become irritated if it doesn't accept the new loads applied to it. So in osteoarthritis, essentially, we've got too much out with the old and not enough in with the new for various reasons. That could be genetic, it could be traumatic, it could be due to an infection, it could just be because we're getting older and things slow down. That irritation to the bone may then cause inflammation within the fluid of the joint, which increases the amount of fluid and may cause swelling that we typically see in osteoarthritis. That then may irritate the capsule, it may irritate the tendons, it may irritate what's called your bursa, like a water balloon, shock absorption water balloon. It can also irritate the nerves. So osteoarthritis is not just a condition of the bone or the cartilage or the joint. It involves nerves, muscles, tendons, ligaments, synovial membranes, so capsules, bursa, and those can all become affected just because this process of remodeling has slowed up. And that's what is written here. They're constantly being repaired, but if that becomes out of whack, too much out with the old, not enough in with the new, then we can run into issues. Quick side note about OA versus osteoporosis. Often people can get these confused because they do sound similar, both having the prefix osteo, which, as we learned earlier, it just means bone. Osteo means bone. We know the definition, osteoarthritis, bone joint inflammation. Here we have bone and porosis. If you take that as meaning porous or more wholly or lets things through, essentially the bones become thinner and more porous. So the osteoporosis is a weakening of the bone. And you can see out here, healthy bone is nice and dense. It becomes less dense the more osteoporotic we become. So there is a difference between the two conditions. Osteoporosis is still an issue with remodeling. There's not enough in with the new, but it is occurring in the structure of the bone and not around the cartilage or the joint. So there is a difference. Osteoporosis is always painless until the bone fractures. Because the bones become weaker, they are more prone to fracturing. But until that point, unless you've had bone scans to show that you have weakened bones, you don't know that you have weakened bones. There are no symptoms of osteoporosis apart from fracture. And then if you are told, or someone tells you, I have osteo, you need to question them, what type of osteo? Is it an arthritic condition? Is it a porotic condition? Because the treatment and management in some instances are similar, but they are different, and the conditions themselves present differently. So if you're told by a healthcare professional that you have the type of osteo, question them to make sure you know which one exactly it is, because management can change. All right, now we're into what I'm going to call the guts of the presentation, the myths about OA. Now I'm going to go through these one by one and break them down. So number one, OA is a disease of the old. Number two, OA shows that my body is wearing out. Number three, OA is always painful and leads to disability. And number four, there is nothing I can do to manage my OA. Number one, OA is a disease of the old. I wouldn't even call this a disease. I would say OA is a natural aging process that can sometimes go a bit wrong, because everyone gets a degree of OA throughout their life. and you'll see that in another few slides. So it wouldn't necessarily cause it a disease, but sometimes it can become painful and inflamed and become an issue. Also, whilst it is more common in older adults, because the remodeling process slows down as we get older, anyone can have OA at any point in their lifetime. Because OA can also be caused by trauma, by surgery, by disease, by many other lifestyle factors. I have had clients in their 20s and 30s and 40s who have had some quite significant arthritis, and some in their 40s I've even had to send for joint replacement surgery because they have been that advanced. Conversely, I've seen clients in their 80s, 90s who have no evidence of symptomatic arthritis at all. So just because we are getting old doesn't mean that you will get arthritis. It can happen at any point in time, but just because we're getting old doesn't mean that you will become stiff and sore from a symptomatic OA joint. So remember that. Myth number two, OA shows my body is wearing out. And I don't agree with the term wear and tear. A lot of people describe osteoarthritis as wear and tear, but I don't like it because it connotates that movement and activity and exercise have brought this on, and that movement and activity and exercise will make things worse because my body is wearing down and it can't cope with what I'm doing. That is just not the case. When I was describing the remodeling process before in OA, and we get this inflammation around here, people tend to think of inflammation as bad. And in chronic situations where it is lingering for a long, long, long time, that is accurate. But in acute situations, you've just rolled your ankle, you've just sprained your wrist, you've just cricked your neck, you've got a cough or a cold. Inflammation is natural and healthy and normal. Yeah, inflammation is your body trying to repair itself, because inflammation brings with it a whole bunch of nice chemicals that aid in immune function, that aid in repair of tissue, and that aid in removal of old nasty tissue. Inflammation is good for a short time. So you could argue that inflammation around this OA joint is actually the body trying to repair itself. So your body's not actually worn down as it gets inflamed. It is actually trying to aggressively repair itself. Your body is working hard to repair it. So this is a theory that the body is repairing or trying to repair what has been caused by the lack of in with the new in the remodeling process. So it could be argued, potentially, this is only theoretical at the moment, this could be potentially argued that OA is a natural response to an abnormal situation. Something has caused that remodeling process to be a bit off kilter, and your body is trying to repair itself. But unfortunately, it's just losing the battle, and that's why it becomes more inflamed and potentially more stiff and more sore. The other issue with wear and tear suggests that I can't do anything about it. It's just my body getting older. This is it. I'm done. And I'll talk about that later. And also suggests that because your body might be wearing out, that other areas will start to become sore, stiff, osteoarthritic. And that's just not the case. Just because you've got one joint with OA doesn't mean you'll have OA spread through the body. In some people, that is the case, and unfortunately, that might be due to genetic factors or the lifestyle factors. But just because you have one joint with OA doesn't mean the rest of the body will, and your body is not actually wearing out. Moving on to myth number 3. OA is always painful and leads to disability. This is just not accurate because pain science tells us that pain does not always mean damage, and that damage doesn't always cause pain. I'm going to focus on the damage doesn't always cause pain part of it. I won't be going into pain does not always mean damage. If you have questions about that sentence, you feel free to shoot me a message and we can go into it. It's a bit more in depth and advanced and out of the scope of what I'm talking about here. But we'll focus on damage doesn't always cause pain. The best way I can describe that is quite frequently you'll look at your arm potentially, or look at someone else's arm, let's say, and just look, oh, geez, there's a nice big bruise there. Where did that come from? Now, bruising is caused by damage to blood vessels, and the bleeding gets stuck underneath the skin. So you can't have bruising without damage. But if you don't know where that bruise came from, you don't know where, you don't know why, and you don't know how, obviously it wasn't painful and the event wasn't significant enough for you to notice it. But yet you've still got the bruise. So the damage did not cause pain for you to notice it. Damage does not always mean pain. And I'm saying damage here because people get scans of their body and it shows things that might be perceived as damage, but they don't actually have pain in those areas. And that's the same with OA. Many people have signs of arthritis on scans, but have zero pain. Now, if you can have signs of arthritis on a scan and have zero pain, that also suggests that if you have pain in a joint with arthritis that shows signs on a scan, that you might be able to relieve, if not entirely remove that pain, but still have the changes found on the scan. So you can have a painless osteoarthritic joint. Now, we'll see here in this image, some smart people have done a lot of studies on imaging around the body and come up with some stats. Now, all these imaging studies were done on people who are asymptomatic, so no symptoms. So in this case, no pain. If we have a look at the knee here, there was nearly 5,400 knees, which is a lot of knees scanned in people with no pain. It was broken down into people over 40 years old and under 40 years old. And it shows that in people over 40 years old, up to 43% of them had signs of OA in their knee without pain. So nearly half of the people over 40 had signs of OA in their knee, but no pain at all. Even in the group under 40, up to 14% of them had signs of OA in their knee, but no pain at all. So it just shows that just because it's shown on a scan doesn't mean it will be an issue for you. And often I've had clients that would have gone to other well-meaning health practitioners, and they'll say, I've got a sore knee over here. So they'll get that knee scanned, and whoever's treating them will say, let's just get the other knee scanned as well, just to be sure. Both knees come back with signs of arthritis. And you go, okay, the painful knee, that's probably why you've got the pain there, because it's got some signs of arthritis. It might be that. And then you look at the other knee and it has arthritis as well. And the well-meaning health practitioner says, geez, be careful with that. You might, you're probably going to end up, with bad arthritis as well. And it'll be as bad as the right one. And you're probably going to need some intervention at some point, which is just not accurate. You can't predict disability or pain on a painless knee or painless body part that has signs of arthritis on it. You can't predict outcomes based on what is shown on the imaging. You have to base it on what the client is feeling or what you are feeling. So just because you have signs of this in your body on imaging, it doesn't mean you will have pain, and it doesn't mean you will have any form of disability. Another good piece of evidence that injury, or I should say damage within the body, doesn't cause pain is on back scans. Now, I know we're talking about osteoarthritis, but back scans and people with back pain are very, very common. And you might even have back pain yourself and have had a scan. Again, these images were taken of people without back pain. Now, if we have a look at these numbers of disc bulges and disc degeneration, nasty sounding words, and people often associate them with my back is stuffed. I'm going to be very sore. I'm going to have issues for the rest of my life. Disc bulging. 60% of 50-year-olds have a disc bulge and they have never had back pain. When you hit 80, 84% of you will have disc bulging, but no pain. Disc degeneration. 37% of 20-year-olds. So those people are quite young, but nearly 40% of people at the age 20 have disc degeneration but have no pain. And once we hit 80, 96% of people, so nearly all of us, will have signs of disc degeneration by the time we are 80 and have no pain. So just because it's shown on a scan doesn't mean it will be painful, and the same goes with osteoarthritis. Rant over. And final part of the myths here, number 4, there is nothing I can do to manage my OA. Often when you are diagnosed with osteoarthritis, people think, oh no, geez, I've got arthritis. This is the end of the world. This is bad. Or the alternative is, geez, it's just arthritis. There's nothing I can do about it. I'm just going to have to live with it. There are many different ways of managing and treating the condition, whilst not necessarily reversing the changes seen on the imaging, because we know that just because you got changes on imaging doesn't mean you'll have pain. There are many different ways of managing and quite comfortably living with this condition. I've known of a few clients who, through changing their lifestyles a little bit, have been able to put off having joint replacement surgeries for their arthritis, and they're functioning quite well. So it can be done. You can put off severe, significant intervention just by changing some of your lifestyle habits, which is what I'm going to go through in the management. I'm going to break this up into 2 parts. So I'm going to stop the recording here, and we will resume with the management side in just a moment. Thank you for watching, and part 2 will be starting very shortly.